Welcome to the Naval Postgraduate School Center for Homeland Defense and Security lecture and webinar series. On behalf of CHDS and our co-hosts, the Association of State and Territorial Health Officials, the Correctional Leaders Association, the International Association of Emergency Managers, the National Criminal Justice Association, and the CHDS Alumni Association, thank you for joining us. Today's webinar is the final in a three-part series discussing housing and shelter challenges during COVID-19. During today's webinar, our panel will examine how the pandemic has affected congregate population management in our country's prisons and jails. We will also consider lessons learned in the early phases of COVID-19 and what those have meant for corrections professionals and incarcerated populations. A couple of administrative items to note before I turn it over to our moderator. All participant audio is muted, and all questions will be held until after our speakers' initial comments. Throughout our session, you're encouraged to submit questions using the Q&A box on your screen. We will answer as many of those live questions as time allows, and we also received several questions from you before today's session, and we will try to get to as many of those as possible. Today's webinar is being recorded, and a link of the recording will be posted on the CHDS Executive Education Program website after today's session. At the end of today's webinar, there will be a short survey that will pop up on your screen. Please take a moment to let us know your thoughts on today's program. And now it's my pleasure to introduce our moderator for today's webinar. Clark Kimmer is the retired Assistant Chief of Police in Seattle, where he served 31 years, the last 16 as second in command for the department. Here at CHDS, Clark is a frequent moderator of our executive education seminars around the country for local, state, and elected leaders. And this month, Clark has served as our moderator in the discussions of housing, sheltering, and congregate population management challenges during COVID-19. Clark, thank you for leading us in this series and for moderating today's program. And now I'll turn it over to you. Thanks for joining us.
Thank you, Don. As Don mentioned, this is the third in our webinar series, which is focused very broadly on the concept and operation of shelters. Today, we're going to be talking about a very complicated form of quote-unquote shelter, namely systems of incarceration. Our participants today, that's all of you, know very well how important this topic is, and particularly from an emergency management standpoint. I've been asked, well, what is the connection between emergency management and systems of incarceration, except perhaps during a disaster? But you all know the answer to that question. If the fundamental, essential institutions of society, police, jails, public health, fire emergency medical, hospitals, prisons and jails, the private sector, are not functioning to their fullest capability, are stressed, overmatched, and overchallenged, then the prospects of managing a disaster plummet, and the options you have are extremely limited. And that is the pathway that leads from a manageable emergency into a disaster, into a catastrophe, and at the extreme, into anarchy. That's the topic we're going to be discussing today. And now I am pleased and privileged to introduce our subject matter panel to you. Their full bios, by the way, are on the website. I'm going to do a bit of a shorthand version of their estimable resumes. First, Dr. Donnell Harvin. Donnell is the Chief of Homeland Security and Intelligence for the Homeland Security and Emergency Management Agency in Washington, D.C. Dr. Harvin has a doctorate in public health and master's degrees in public administration and public health. He's a former director of special investigations and operations for the New York City Medical Examiner's Office and chief research scientist for the New York City Department of Health. And in his abundant spare time, Donnell is on the faculty of Georgetown University in emergency management and disaster management and applied intelligence. Donnell is also my co-facilitator for this session. We designed this together. I'd like next to introduce my new best friend, one of my two new best friends, Kevin Kemp. Kevin began his career in 1995 as a correctional officer at the Pocatello Women's Correctional Center in the state of Idaho. He went on to serve in a variety of positions, including parole officer, investigator, section supervisor, district manager, warden, chief of prisons, and deputy director. The Idaho Board of Correction appointed Kemp director of the department in December 2014. And also early in his career, Kevin was appointed to the Interstate Commission for Adult Offender Supervision. In 2016, Kevin was appointed as the executive director of the Correctional Leaders Association, CLA. CLA members are the CEOs of corrections in the United States. And finally, my other new best friend, Brent Trowlby, Section Chief for the Michigan Department of Corrections. Brent oversees statewide core functions to include the department's emergency response team, security threat groups, intelligence unit, emergency preparedness and disaster management, and he's the department representative to the State of Michigan Emergency Operations Center. In addition, Brent is the supervisory liaison to the State Homeland Security Center and is Chief Security Officer for the Michigan Department of Corrections headquarters. Within the state of Michigan, Brent provides support to 30 correctional facilities and 105 field offices. And last but not least, he is the recipient, through his hard work, of a master's degree from the Center for Homeland Defense and Security at the Naval Postgraduate School. So the content of this webinar today was developed through the thoughtful questions posed in advance by our participants today, and the Center's longstanding relationship with experts and professional organizations throughout the nation. Bottom line, you are all SMEs, and we thank you for your dedication, your expertise, and your humanity. This important series of forums and interactive discussions is founded on the Center's and the Federal Emergency Management Agency, who is the funder of our center, philosophy that our nation's homeland security depends upon building community capacity and resiliency through rigorous problem solving. First question to Kevin. Are there established or emerging programs that your leaders believe show the nation a way forward to reimagine systems of incarceration, both from a public health and public safety standpoint, but also social justice? Aspirationally, what does a future look like for systems of incarceration?
Thank you, Clark. I think that's a great question, and it might be something that you see me talk about a couple different times today. But first and foremost, I think one of the things that we need to do is to continue to educate lawmakers and judges of the fact that prisons, by and large, make people worse. They don't make people better. I think we need to do a better job of making sure that the right people are getting sent to prison, and everyone else gets diverted to something that looks non-custody related. And so when you have situations like that where your numbers are going to be fewer, it's going to allow us, correctional professionals, to exercise best practices, to put forth, programming and opportunities to make those people that are in custody more successful, as opposed to, of course, having a whole bunch of people in a confined space across the country.
You'd mentioned the education of lawmakers. I mean, is there something that needs to be mended there? For example, I believe we talked earlier about how when the question was raised, well, who could release prisoners, there were crickets being heard. The answer to that question was not readily to hand. So when you talk about that, what do you have in mind?
Well, first off, I think correctional leaders are a perfect person to do that educating. It's a great opportunity for us to just be very transparent in talking to decision makers about what I said. Again, by and large, don't send people to prison if you expect them to get a whole lot better. It's a tough environment. It's a difficult environment for people to experience a lot of growth. We need to send people to prison that we as a society are scared of, but not mad at. And so I really feel like correctional leaders across the United States are in a perfect position to be communicating this to lawmakers and judges, because they ironically sit in the seat where these people would be coming to them. So they're just in a great position to say, look, we would rather them be diverted to other opportunities in the community where there are some.
Thank you, Kevin. Donnell. So a regular theme in all of our webinars, and certainly today, expressed by our participants, is that decisions are often made in a vacuum. There's concern that decisions that cross jurisdictional lines or public impact are made without involvement of all the involved parties. For example, maybe we could say this about the early part of the COVID crisis. It seems like all the decisions were being made by public health and elected officials. Is this truly a problem? And if so, what's a path forward to try and broaden the table or widen the table to at least get the viewpoints and analysis of everybody potentially affected by decisions?
Yeah, Clark, you threw me a hard one. So there's two forces come into play here. One is that often people don't see correctional health as public health, and that's a fallacy. And we'll talk about corrections and incarceration, but from a public health standpoint, in the prison system particularly, there is an ecosystem that allows certain pathogens to breed, and we've seen that historically. In the jail system, in fact, it can be reflective of the community, which means that pathogens can move from the community into the jails, and since it's more transient than the prison system, back into the community. We've seen that with tuberculosis, we've seen that with HIV/AIDS. And so that's one thing. Other than obviously the population is a population that really can't defend themselves. They need advocacy groups often to do so. The other part, and we've talked about this in the other seminars, is that there's been great guidance, and I'll talk about some of the guidance going forward, but it's often executed differently at a state-by-state or local-by-local basis, and often it's reflective of the politics of the time, and this has been a very political disaster, or the resources that are available.
Continuing with our theme of the big issues, the hardball questions, right? I'd like to turn to Brent first and then hear from Kevin. So the headline these days, and actually for some time in the past, is about reduce jail populations, prison populations, in incarcerated populations. Now, that's a vision that's seemingly shared by an entire spectrum of experts and advocates, from pretty radically progressive reformers to your folks in CLA and the administrators and leaders on the ground managing systems of incarceration. What do you believe to be the predominant objectives that are now being in use or being evaluated to reduce and de-densify prisons and jails? Start with you, Brent.
I agree with what Kevin said. We got to be selective on who goes to prison first. But when we get them there, we've got to be able to provide the programming necessary to make them successful when they leave. So when we talk about reducing the population, I can speak specifically to Michigan. We were already on the downside of trying to reduce our population over the last few years. So I think we were better prepared when COVID hit to continue down the path that we were already on. We were pretty much averaging about 73 to 75% parole success rates before COVID, and we've maintained that throughout COVID. And one thing that we were able to do, our leadership decided early on that our parole board would continue to work through the pandemic. And really what it's allowed us to do is to shave a few days off here and there on our parole process. And we maintain consistency with the safety and security of the paroles. We haven't changed our process as far as that goes. We weren't just releasing because of COVID. We just continued on the path we were on, but we were able to shave some time off of the reviews that we had coming in from parole violators, as well as able to work with our community partners in helping to secure some programming that we maybe couldn't provide inside the correctional facility. So we've maintained that process, and I do agree that there is some call for criminal justice reform, and Kevin is right. Our leadership at the correctional state levels and local levels are the ones that I think are going to have the biggest impact.
Kevin, I'll pitch it to you, and I'll expand the question a bit. Is there a generally accepted tipping point, some kind of threshold where release may imperil public safety? Where that kind of balance is kind of precarious. And if so, what is that criteria? But also your thoughts on the movement to reduce the population.
Yeah. Thanks, Clark. You and I talked a little about this the other day, but it was really fascinating. Just weeks into the COVID crisis, there came a lot of noise about of releasing inmates. And what was fascinating to see across the United States in individual states, and I suspect even down into the counties as well, is who actually has the authority to do that? Is it a governor? Is it a parole commission? Is it the correctional director? Is it the legislature? And as you can probably imagine, it varies across the United States. And so, we spent, probably 3 or 4 weeks individually trying to figure out who actually does what and what authority they have. But once that was figured out, and there were systems that were interested in reducing the amount of people incarcerated. What hit us straight in the face, Clark, of course, we have challenges releasing people under good circumstances, let alone under a COVID crisis and a pandemic. And so all of those challenges were magnified across the board. Now, the good news that came with that is it forced our hand to partner with prison advocacy groups, community advocacy groups, in a much more advanced way than we have in the past, because frankly, we needed to do it. I mean, there was areas that just absolutely needed to do it. Now, transitioning to your question, as far as the tipping point, you bet. I mean, there is a tipping point. There are concerns out there, but going back to what I said earlier, and Brent, said, it starts with making sure that the right person is incarcerated. And then if there is a situation where that person is going to get out, you need to use risk-based tools to see if that person is going to, or what likelihood that person is going to recidivate in the community. And of course, wrap a bunch of resources and around them.
And none of these considerations and criteria and guidelines are political at all.
Yeah, that's right. That's right. No politics involved.
Well, my chief political consultant, Donnell Harvard, I'd like to ask you this question. It's somewhat related. So, we talk a lot about medical search, right? The whole idea of search. What I want to ask you about is, what about public safety and public order search, particularly as concerns incarceration systems and facilities? We may be successful in significantly reducing, and we are being successful in significantly reducing populations incarcerated. But what happens when, and this is a real potential given this election season, we have widespread civil disorder, even riots, and other criminal campaigns that are going to require the incarceration over some period of time of dangerous populations. I mean, in a sense, if we've de-densified and reduced the facilities, do we now lessen our options to meet a surge? And I'll ask Kevin about this, or Brent, after you.
So that's in keeping the theme of our seminar, complex question that requires a sophisticated and nuanced answer, the time of which we don't have allotted really here. I'll give you the Reader's Digest version. There's tons of studies, and I'm not a criminal justice expert. We have gentlemen on the panel who do this, who suggest that if people aren't released in the proper conditions, they will come back. I think what Kevin articulated is it's difficult logistically and financially to create those proper conditions when you're trying to force people out of the doors from incarceration and have them transition properly into society. On the other hand, to prevent a public health crisis within the prisons. On the other hand, we have another public health crisis that very few people are talking about, but people don't realize it's a public health crisis, and that's the rise of violent crime and homicides in our inner cities. Now, not to say that there's a direct correlation between the releases and that violent crime, but clearly one can draw a conclusion that if people are released in a manner that doesn't bring them back into society, integrate them properly, then there's a potential that they can slip back into the life of crime and obviously be part of this growing wave that we're seeing in many of the cities of violent crime. In fact, many of the cities, particularly, are talking about handling the rise of violent crime, particularly homicides, as a public health crisis.
Let me pitch that to Kevin, and then if we have some time, maybe Brent as well. I'm thinking of a field of dreams, right? If you build it, they will come. I think we're looking at the inverse of that. if you basically deconstruct something, there's no place to go. And as Donnell points out, we are already in the midst of a potential epidemic, maybe more than we've ever had, in terms of violent crime. There are a lot of factors that go into that. So again, this balancing act of how do, and it's mainly a jail issue more than a prison issue, but how do we, strike the balance to have capacity if we need it, but also to meet the noble and righteous objective to not have people in prison or jails that shouldn't be there. Go ahead, Kevin, why don't you start, and then I'll turn to Brent.
Yeah, Clark, what comes to mind as you're talking and Dr. Harvin's talking is, I just want to scream from the rooftops to our country that 97% of people that are incarcerated are coming back to their community. This notion of putting someone in prison and throwing away the key is not realistic. It's just simply not realistic. But for people to consider it, or people that can continue to believe that, it allows them to not be involved or get involved in part of the solution. So the first thing we have to do is everyone has to realize that these people are coming back to your community. Whether you like it or not, 97% of them are. And in order for us to be successful as a country, we need to look at what's working out there. And I know there are countries out there. I myself have spent a considerable amount of time in the country of Norway. I know there's vast differences, of course, between Norway and the United States, but Norway as a country decided to change their entire philosophy as it relates to their incarcerated people there. And it's an amazing thing to see how, as a community, they have in fact embraced the fact that they're part of the solution. You can't just turn a blind eye to it and think that it's a corrections problem or it's a police problem. I think as long as we continue to do that as a country, we're not going to be successful in getting to where we need to go.
Couldn't agree more. Brent, let me put the question in this way. Is there a correspondence between reducing populations, incarcerated populations, de-densification, and also then decommissioning the facilities or programs themselves? I mean, is this a scalable situation? And again, I'm going back to this idea that when we need jails in particular, but maybe even prisons, are they not going to be able to accommodate maybe a short-term need that is occasioned by widespread, say, civil unrest or other dangerous, scenarios to continue public safety?
Well, I'm going to use Kevin's approach to it takes a village to do this. It's not just a correctional responsibility; it's a community responsibility for what we're doing here. And I think there's a definite difference between a county jail and how long we incarcerate somebody for in the state correctional facility, which is typically a longer period of time. So you generally have, as a correctional agency statewide, you generally have more time to work with somebody in the prep room. Jails, I think, have a more difficult task because you have such a short turnaround that you may not be able to provide the programming or may not have the connections into the community that are going to help somebody be successful. And I really do think that jails can learn from correctional facilities that have the time to develop these programs. But I think the difficulty is going to come in how we develop those in a short turnaround time for some of these individuals that are getting turned around very quickly. And really, it's going to come down to taking a look at if we use Kevin's theory of 97% are coming back, which we know they are. We have to find those partners that are willing to help us make them more successful, so 97% does not come back. And I just think that at a state level where you have offenders in longer, you have the buy-in from the community. And I think we just really need to work on trying to work with the local governments and help improve that process for them. And I think they can look at some of their state level partners that have developed programs that maybe they can take a piece of and start that.
If I were to put the question based on the three of your comments, it seems to me one Q&A would be, well, what happens when you need facilities that have been decommissioned through de-densification? One plausible answer is, well, we probably should be looking at other options than reopening and expanding jail populations. and community-based solutions seem to be the answer. But you talked about jails, and there's a difference between jails and prisons, obviously, but there are also many similarities. I did an interview with the executive director of the King County Department of Adult and Juvenile Detention, John Diaz. John, interest of full disclosure, we were cops together. We were on the command staff. John was the chief of police in Seattle. We both had between 31 and 34 years, and we are very good friends. As a friend, I just marveled at the idea that he would go from being a chief of police to the director of a county jail, and actually suggested some kind of counseling for him. But he's actually been thriving in that and enjoys the challenges. So he's had a distinguished career in public safety prior to being appointed as director of King County Jail, as I mentioned. He was chief of police in Seattle, rose through the ranks with me. I was the second in command. He began his career as a criminal investigator with the U.S. Army, graduate of the FBI National Academy, the National Executive Institute, and the Senior Management Institute at Harvard. He's recipient of the Unsung Hero Award for his work on eliminating racial profiling. And he's on the boards of King County Salvation Army, City University, the Center for Children and Youth Justice, and the U.S.-Mexico Chamber of Commerce Northwest Chapter. So we've got an interview with John that we're going to share with you. Now, to start, John's team at the King County Department of Adult and Juvenile Detention runs 3 facilities, one juvenile, 2 adult. The juvenile facility is very, very small, at least in population, somewhere around 25. The 2 adult detention facilities manage an average daily population of about 2,000, at least before COVID. He has a staff of 950. So let's take a look at this interview, and I'm going to ask him to start. How has the population changed during the COVID crisis? What's your census look like maybe at this moment in time?
We got the ADP, the average daily population, down to about 1,300. And so about a third of the people we were able to move out. The court started using more electronic home monitoring. We did some things with our community corrections, which is also one of the programs that I run. And we were able to really start diverting people from outside the criminal legal system. All of it's about social distancing. All of it's about trying to keep people separate. So I am proud to say I'm running these facilities about as inefficiently as you possibly can at this moment.
Have you achieved the kind of de-densification that all of the public health folks are saying you need to, at a minimum, actualize to manage the jail population?
Well, if we could keep the numbers right down in that 1,300 to 1,350 range, we're able to keep things very safe. In the 7-8 months that COVID has been with us, we've had, I believe, to date we've had 20 inmates total that have suffered COVID. None of them had any serious issues. Several were asymptomatic. But we've done a number of things to do that. We being that I have an incredible staff of people that do some fantastic work, working in close conjunction with jail health. So the minute somebody walks in the door, we put a mask on them, we give them a temperature check, and then just recently we started also asking them if they were willing to take a COVID test, and we have a rapid test that we're using that's about 20 minutes. So we added that to the mix. But the way we've done it is you walk in the door and you go through booking. If you have any pre-existing conditions or whatever, you're sent to our Kent facility, which is about 20 miles south of our main jail in downtown Seattle. If you have any symptoms, we have a separate area for you where we keep you separate. And if you have COVID, we have a separate area for you. So it's all about managing that, those individuals, trying to make sure that we keep people separate and at the same time allow them enough time out of their cells so that, for mental health purposes, they're able to spend some time outside.
Let's go beyond COVID-19. I know it's tough to imagine a world, that will no longer have this crisis, at least maybe not to the degree we have it right now. But you're not just dealing with that public health de-densification mandate. You're also reimagining the use of the jail. What does that look like for you?
First of all, lead with social justice. The next piece we're looking at is, can you take a look at ways that you could keep people from ever touching the criminal legal system? And I think all the studies have shown that the more we keep them out of this, keep anybody out of the system, the better it is for all. And truly, we're looking in 3 areas. Where could we divest some of our funding that we have? I think if anybody looks at their general fund anywhere in the country, the largest piece of that's going to be public safety. It's no different here in the county. So where could we divest where it would make sense and reinvest into areas, particularly focus on community programming? And then lastly, the third piece of this stool would be, where could you reimagine? Where could you reimagine how you would do things? So, I mean, what a great mandate to be given.
Thank you, John, very much, and keep fighting the good fight here. We're going to now focus more on the participant questions we've already received. This is what we're going to dedicate our remaining time to, answering your questions. We've retooled them and coalesced them to really get to the heart of what so many of you good folks have been asking us to address. We have several questions, of course, that were submitted in advance when you registered, and we also have, of course, the live Q&A function, which we encourage you to use, and we'll get to that at the conclusion of our next round of conversation. So I'm going to start with Brent. John Diaz described testing protocols implemented at the King County Jail. You've been at the forefront of testing for the Michigan Department of Corrections. Please take a few minutes for us and talk about your protocols, your challenges, and some of your results.
Well, I appreciate that, Clark. And John hit on a lot of those points, but I think we could spend nearly a day just talking about the challenges associated with testing. And I think for Michigan, I want to start by saying that we've had a pretty progressive leadership in our agency, which has been very helpful for us. But one of the major challenges we had is right out of the start, we are held to whatever standards are set by our local public health or our state public health, as well as what's driven by the federal policies on public health. And I think early on, the country as a whole was trying to figure out, how do we test COVID? What's the process? And it tended to change very quickly, and we had to be fluid. So one of the main challenges we had was the fluidity and change within testing protocols and what that looks like. The second major challenge I want to talk about was the availability of testing supplies. I mean, early on, we struggled to find out how to even get testing supplies. When they came to the state of Michigan, where they would go first, what was the priority. And not to say that jails and prisons aren't a priority, but when you compare a community to a jail or prison population, where does the community think the priority lies? So I think you need to really take a look at the supplies. That was a challenge for us. Some of the other challenges is you can write the best plans in the world, but nobody writes a plan for a pandemic response that has this level of sustainability. I mean, we're used to writing plans for flu outbreaks, not a pandemic that lasts months and months and seems to morph pretty much every day. So those were the challenges that I would say on a high level, really we struggled with a little bit. What we did though is we did adapt our protocols on the fly. And I think we mentioned it earlier about after action reports. We're doing after at the end of the day reports right now. I mean, literally we have a day, our leadership team and some of those affected by the decisions and the processes of the day get together. We have a debriefing, a hot wash, if you want to call it that, and we figure out what went well that day and what we need to fix for the next go around. And that really has been very helpful for us. Our leadership team has been very inclusive in that process. So all the way from the lowest level to the director, we've had these conversations about what we did well and what didn't work and how we change it for tomorrow. So after action reports, I really don't know what that looks like right now. It's a briefing verbally, and hopefully we'll keep gathering information to write a whiz-bang report for better plans in the future. As far as testing protocols, we learned about cohorting. In a jail setting and in a prison setting, you're dealing with multiple levels of security as well as open dorms, sometimes open bars, sometimes cells, where cohorting and stopping the spread is different for each of those areas. In a state level agency, we had all three. So we were trying to figure out the challenges associated with each correctional facility, almost as if they were their own island, because they had a different physical plant setting. So we were writing protocols almost specifically for each area. Generally, protocols were the same, but specific to each facility and how they could cohort, which I think you can all imagine is a challenge in most of our correctional facilities when your populations are fairly high for the size of the facility that you have. So cohorting is something we've continued to do. Result-wise, one thing that I can say is that when we decided that we wanted to start testing at one of our facilities where we had a significant amount of positives, in the testing early on was only testing symptomatic. That's all you had. You had enough tests to test your symptomatic. What we started to learn was that wasn't enough. So when tests became available, we took our highest symptomatic correctional facility and tested every single offender at the facility mandatorily, and then voluntarily tested our staff that were willing to volunteer to be tested. And really what that did is it gave us a footprint of what we were working with. And an idea that what we discovered really for us was that our largest population was asymptomatic, but they were positive. So we had a lot more positives than we thought we had after we did mass testing. So the mass testing really helped us identify how to cohort better. And we ended up ultimately opening up other units to just put positive inmates in so we could cohort them separately and really protect the negatives that we had out there. That was our theory. And then once we figured that out at one correctional facility, we reached out to the National Guard for help in testing all of our facilities. And so as a result, because we're a state level agency, we leveraged that resource, and then that gave us an overall footprint for our entire agency. I guess the positive result is we were one of the first in the country to test every single offender in the state. And that has really allowed us to manage our population better and reduce the contamination of the cohorts as best we can. So that's a lot to say. I'm sorry it took a little bit longer to do that, but each of those can be broken down into separate discussions. But I will tell you that the mass testing has been very beneficial for us as an agency to identify where our issues are at and try to attack them as best we can.
Right. Thank you so much. And thank you so much for spearheading what sounds like really a groundbreaking initiative that we could all learn from. I did want to turn to Donnell. You heard the words you always want to hear, which is we are conducting after action reports before the action is over. Just give us some metaphysical guidance on the importance of that.
Yeah, like we've talked about this the last couple of weeks. The protracted nature of this disaster is unlike anything we've ever seen in our time. And generally, if you're in emergency management or crisis management, you're used to an incident unfolding over the course of a day or maybe a couple of weeks, but not certainly a couple of months. And so any reasonable and serious public health official that I've spoken with or colleagues that I've worked with anticipate that this particular pandemic will be in the throes of well into spring for a whole host of reasons. While you may hear that there's a couple of vaccines ready to come out, having needles in arms in hundreds of millions of people and getting to some level of herd immunity may not be achievable, but it's going to take some time. And I don't want to put an exact time, but I would anticipate we'll be doing this again for the next 5 or 6 months. So now is a good time for officials to take a kind of breather and have a retrospective perspective on what they've done heretofore. And what Brent's talking about, I've read studies about and articles about the work they've done. That's laudable. Unfortunately, and Brent will know this and Kevin will know this, that's not happening in many places in the country for a whole host of reasons. And we can talk a little bit more about that.
I'll get back to you in a little bit about the application of guidelines like CDC guidelines on these systems and the pluses and minuses, I suppose. But I want to turn to Kevin. So for incarcerated populations in general, before COVID, but especially for those who are released early or even unexpectedly, for want of a better term, the challenges of reentry and safety nets and integration support is very daunting and complex. How do you size up the status of reentry support and reentry programs, especially now that COVID has forced rapid retooling of existing systems?
Yeah, thanks, Clark. Well, if a system did not have a structured reentry process in place before COVID, as I mentioned earlier, it's going to be strained or certainly magnified with problems now. But how best to go about doing that? First off, you've got to involve the community. There are systems. I'm here in the state of Idaho today, and Idaho has a community mentor program that's been very, very successful. It started up a few years ago, and where we just tapped into what we saw in Idaho of just the general public that have a very high percentage of them will volunteer their time to a variety of things. Well, we tapped into them and asked that they be part of this, and certainly went to the faith-based communities across the state and asked them to be a community mentor, where we actually trained them, and they have very specific roles. I should say that a major part of this program was actually stolen from Brent's shop in Michigan. Myself, a few years ago, and the governor's office at the time sent us to the state of Michigan, where we spent about 4 or 5 days with Pat Caruso, the then director, and learned of the things that they were doing and how they were transitioning people from a prison to a community. And before that person ever stepped foot outside of that prison, they were making contact with a community mentor via phone that was basically introducing themselves back and forth, and then finding out what the needs were. And then that community mentor had the responsibility to help on the ground in the community. And so we adopted that same program here in Idaho, and I know other states have done it. But that is certainly a significant way to assist someone in getting back to the community. Our probation and parole officers, they do a great job across the board. But certainly anywhere where a community corrections program looks more like surveillance as opposed to hope is probably not going to be as successful as they can be. And so that community mentor really takes on a role of providing that hope, providing those resources. They know people in the community, they're already established in the community. And so it allows them to pull these people right into their world, so to speak. So you've got to have those types of things going on in your system to be successful.
Brent, anything you want to add to that as approaches to reentry that maybe are leading edge or that are tried and true, that kind of thing?
Sure. Thanks, Clark. First, I appreciate Kevin giving us the props there in Michigan. We've been working very hard, and as you know, Kevin, it's followed through, and Director Washington has taken the baton and is moving that further ahead yet. One of the things that we've done in addition to the community mentor program, and I know Kevin's seen this, it's our vocational village, where we're actually providing skilled-based job programs and vocational programming to get our offenders employment prior to leaving a secure environment, to the point where we actually are having employers invested in the communities that are coming in and interviewing and offering jobs prior to release from secure environment. And many of the studies, and even Norway included, as Kevin mentioned earlier, indicate that those that are employed with a livable wage are less likely to return to a life of crime or return to incarceration, because they're able to support themselves and their families, and it's a feeling of accomplishment. But at the same time, those community investments have really helped keep that check and balance with the offenders we release. So they're helping them get to work if they don't have a ride. They're working with other organizations to make sure that they meet the requirements of the parole. We've actually taken it a step further with parole and probation and trained some of our agents in the vocational village training and employment, so that now they're involved in caseloads for offenders. And our current recidivism rate for that vocational village is in the single digits, just for that program. So it definitely it's a good time to pitch a review out there. I actually wrote my thesis from NPS and on our vocational village program, just to pitch a thesis there if anybody wants to take a look. But Kevin's right. You got to have the investment, but the investment has to come from both sides, because we have to share the responsibility of an offender's success, no matter how. If they're successful, it's because both parties were involved. We can't do it. The communities can't do it. We need to prep them, and both parties have to be there to make it work.
Good, excellent point. So Donnell, and this is a question that many of our participants over the course of this webinar series have been asking. So when we consider significant re-engineering of any system, in this case prisons and jails, but whatever, disaster shelters, homeless shelters, etc. The question of standards of care and standards of safety are inevitable and necessary. So what are the model practices that go into establishing such standards? You have talked a lot about the CDC guidelines, for example. Now, overlaying a set of guidelines on complex systems like prisons and jails may be easier said than done. And in the kind of real world, it's those standards against what the real world tells you needs to be and can be done. So tell us a little bit about how that process works or should work, and in particular, maybe look at the overlay of existing guidelines that are, fairly, they're evolving onto complex systems.
So that, once again, another great question. Just so the viewers have an idea of the scale of the prison system, roughly 2.3 million individuals are currently incarcerated, and that's a snapshot. And that's a snapshot that I got from the Prison Policy Initiative, rather. But that doesn't tell the whole story. The whole story is that there's a more transient population within there, and upwards of 4.9 million people come in and out of the prison system on an annual basis. And so that's the distinction we need to make between prisons and jails. People are coming in and out of the jail system. People are staying more in the prison system. There's vastly different public health infrastructures available to people in jails versus in prisons. Neither of those public health infrastructures are able to handle what this COVID disaster has thrown at them. And so the burden of taking care of the most sickly really falls on the local public health infrastructure, which is the hospitals that are taking care of those people in the community. And so already we're at a disadvantage. Moreover, and Brent and Kevin can probably lend something to this. I'd like to hear their perspective. We all know this, we haven't mentioned it, so we'll just throw this out there. A disproportionate number of those who are incarcerated are of people of color. And we know when you combine that with COVID is really having a disproportionate effect on people of color. And so that's kind of doubling down on what they're seeing on the ground in prisons and correctional facilities. And so I'm curious, and as a follow-up to them, are they identifying these individuals who are highest at risk, which is one of the things that is recommended through the CDC. Lastly, we talked about last week, the CDC has put out some great guidance, and we're going to give that to the folks here in the seminar. Really good things I can point you to. One is the CDC has correctional and detention facilities website that you can go to, and they've also issued interim guidance on management of coronavirus in correctional detention facilities. Those are guidelines, they're just as good as, once again, the decisions that are made by decision makers and the resources that are available to those decision makers to enact these guidelines. What we have seen, and I'll just end with this, is that the UCLA Law has a great website. It's called COVID-19 Behind Bars Data Project, really good dashboard. These guidelines are implemented in varying degrees state by state. And so you're going to see a state-by-state approach. You may even see a county-by-county approach. Some county sheriffs who run prisons, who run jails, are a little more forward-leaning when it comes to public health, and some aren't. And so there's a huge disparity within the disparity that's created this public health disaster.
So let me ask, why don't we start with Brent and then Kevin. So when you were developing, say, protocols and redesigning the system, reimagining the system in light of COVID, what were you relying on? Was it the CDC guidance? Was it your state health official? Some combination thereof? What was your kind of initial template? And then maybe if you could briefly comment on what did you have to depart from out of a practical set of considerations?
Yeah, so initially we were working with our state public health department, but they were following the federal guidelines. So I think it was a combination of the two. And we have referred to the document that Janelle is talking about on multiple occasions as a baseline on how we would put forth some of our protocols. I think the issue with us, for the most part, was that those protocols seem to change very frequently. And we found ourselves writing protocols multiple times every few days just to accommodate those. And so I think the longer we get into this pandemic, the more sound practices have been documented. I think the protocols will start to stabilize a little bit. But early on, we did struggle a little bit with that. And sorry, Clark, can I get the second part of the question? Because I heard the first part.
Well, I think you've answered it, Brent. It was what works, what doesn't. I mean, I think the question that emerges from the discussion that you're having with the participants and with Donnell is you got a patchwork of guidelines. Yes, there is a national set of guidelines for the CDC and others as well. FEMA's produced some things and they're all very useful, but it's really a state-by-state process, isn't it? I mean,
it is. And one thing that we've done within Michigan is we have shared our protocols with anybody that wants them in the incarcerated settings. Now, ours are not perfect, but there's no sense in recreating the wheel. If it's something that works, try to take whatever you can from it. The other thing that we've done is we've worked with our local county jails to make sure that the protocols we're putting in place, they're trying to put some of those protocols in place before we receive some of those offenders from the county jails. And that has been helpful because we've created not just protocols, but postings and guidelines and checklists that can be helpful for the county jails so that when we receive somebody from the county, we're confident as a state agency that their protocols are sufficient enough so we're not taking in potentially positive COVID offenders as well. But we use the same process on the outside. Before somebody leaves our system, we're following the same protocols to make sure that the community, public health, and the community leaders are aware that we are testing prior to departure. Even if we have a close contact or person of interest, we still isolate them prior to releasing them into the communities. So we are taking the steps on both ends to make sure that we're meeting as many of the guidelines that we can from the CDC as well as the state and local public health departments.
Have anything to add to that? I mean, with the various, actually fairly singular and then adapted set of guidelines, however much they change. We have a pretty clear set of them right now. Do they contribute to confusion or clarity or a little bit of both?
Well, I think that the confusion comes because of the frequency of change. But once we understand how they work, really what we've done is leverage our facilities that have had higher populations of COVID related issues. And we've actually sent wardens from one facility to another that was just starting to experience an uptick in COVID. And that seemed to really help because we took somebody that had been through a process of protocols that is now familiar with them, that is on the ground, and moved them to an area to work with somebody that's just now experiencing some of those same issues. And that goes along with we're doing the after action as we go. That's kind of how that works. We have somebody with experience. Once somebody starts to encounter some issues, we are sending somebody with that experience right to help them out as they go. And we are definitely seeing some enhancements in how we're responding to these things when we start, especially now during an uptick. We're starting.
Thank you. Kevin, you kind of oversee the Congress of CEOs around the country for corrections and prisons. What's the general kind of set of feelings about or interpretations of the overlay of standards of care as defined by public health, for example?
Well, Brent, I think Brent said it best. I mean, it evolved. It was evolving sometimes on a daily basis. So there was a lot of confusion, especially early on. And then on who to listen to, who do you need to have by your side at all times? There certainly has been some clarity, that's come, over the past couple months. But I think, Clark, this is probably a good time. I would hope that the participants that are watching this today, listening to Dr. Harvin and what Brent just said, and of course you, and go, oh my gosh, like how do you even do this? And the reality of it is, everyone from a sergeant at a jail to a director in a prison setting, and everyone in between has done an absolutely remarkable job. I mean, really, think about the complexity of what we're talking about. Not only do these correctional staff and correctional leaders have responsibility for millions of people that are incarcerated, but they've got responsibilities for hundreds of thousands of staff, in addition to their own families that are home, that are struggling, that are asking their mom or dad, please do not go into work today. You make $15 an hour, and we don't want you risking your life to go into a setting where there's people positive with COVID. It's been just remarkable to watch how folks from the emergency management to police to corrections to everyone that plays a part in the responsibility of these things that we're talking about have just continued to show up every day. And I'd be remiss, I'm sure we all would be remiss not to mention that, because I know who the participants are on this list. I looked him over. I know that there's captains and sergeants and officers and non-uniform staff that have just been battling this thing every single day and continue to do so. So the complexity of this issue is just enormous. But thank heavens we have people like this that are up for it. So
amen. Amen.
Can I get a follow-up?
You bet.
So either Kevin or Brent, from a public health standpoint, and we saw this when we were talking about the shelters over the last couple of weeks, have you had any of your colleagues experienced shortages in either PPE or supplies or expertise? And the reason why I say that is because CDC's put some pretty solid guidelines together. But sometimes those guidelines need to be interpreted, right? And really made and give context to your particular situation. So have you had a shortage in expertise vis-a-vis your local public health folks who are out there trying to fight the virus on the front lines? They're going to the nursing homes, they're working with the hospitals, they're working in the community. And then you have to add a prison or a jail to that. What are you seeing on the front lines in that?
Well, I think initially early on, PPE was of the utmost importance, and we just did not have enough. No idea how fast you would burn through PPE at a rate when you're wearing it 24 hours a day, 7 days a week for all your staff. And so initially, I think that was the biggest struggle to overcome was the PPE and then how to get it to folks. We did have some PPE, but what we ended up doing in our agency was if you weren't a facility that was impacted, send us your PPE, and we put everything in one centralized location. And then we were issuing PPE out to those that were currently experiencing higher than normal COVID so that we could get that PPE to the folks that needed it. And we didn't have people sitting on PPE. So that initially, that was a struggle. And then trying to acquire more PPE. As you know, everybody was trying to get PPE early on, even with first responders in the communities. And statewide and nationwide, everybody's trying to get PPE. So we did struggle with that. We are a little bit better off now, thanks that the supply lines are up and moving, and we do have that in place. But still, it's one of those things. How do you determine how much PPE is appropriate? So when you talk about those guidelines, sometimes when CDC comes out with something that says full PPE, that's going to be different for a correctional officer than it is going to be for somebody performing a procedure on a potentially COVID positive person. So for us, it was trying to understand that clarity piece on what PPE was needed for the appropriate job. As far as the expertise in the area, we were very fortunate that we've had a good working relationship with our other state agencies. What we've done throughout the course of COVID is really reinforced our relationship with local departments, because not only do we have to report COVID stuff to the state public health within the counties where our prisons reside, we also have to report that stuff to the local public health directors. And one thing that we learned early on is that we just didn't talk to them enough prior to. We never had to. So now we've really started to reinforce those relationships from the local level and making sure that we communicate, because right now communication has been our best friend. Even if we're transporting an offender from a correctional facility for treatment, we are calling ahead to the local hospital to see if they even have the capability to accept. And those are just things we didn't think about before. So we've really started to garner some of those coalitions. So I would say that early on, maybe we didn't have the expertise, but I think we've actually built a network of expertise just because we've had to.
And I think a big question we've been teeing up throughout this session is, and how is that expertise shared? What contributes to the national kind of accumulated knowledge and experience that this crisis has created for everybody, for all these professionals, like you say, like Kevin said, from the sergeant all the way up to the jail director. Everybody is learning. Everybody is working out, solutions to problems. And I guess I'm a bit concerned that all of that might just be, shouting into the wind or lost in the urgency of bigger priorities. Kevin, you're the head of an organization that I think attempts to build that body of collective knowledge and experience. I mean, what's the future look like? I mean, are we in a position to say, yeah, we are capturing what we need to figure out how to move forward?
Yes, Clark, we were fortunate very early on in the COVID crisis. We recognized first off that this is such a significant issue that could play out a year from now or 2 years from now. So we better darn well capture what's going on, lessons learned, and create a best practices document, which we have done and continue to do. And so that's been of great help to us. But just again, this thing was just as Brent described. When we started out, we probably didn't have the expertise at the table, and certainly supplies were limited. But since that time and throughout that time, we've just we've had a tremendous amount of help and expertise from our health community, and certainly the supplies, not only from our own government, but from our prison advocacy groups, have been really, really so helpful to us to reach out and say, man, what can we do? A group that comes to mind is Reform, for instance. It's headed up by Jessica Jackson and Van Jones. They've got a lot of influence and resources, and they have put them to work in helping our correctional agencies get much needed PPE and everything else that we've needed.
Great. Thank you. Well, I think we're going to turn to our Q&A, live Q&A, folks. And so I'm going to ask the ethereal voice of Don Wilson to help us through some of the questions that have been coming in.
Thanks, Clark. A lot of great questions coming in, and a quick programming note for folks who've asked about links to some of the documents that have been mentioned by our panelists today. Our team is posting several of those to the Q&A box there, so you'll be able to find those links. And we'll also, again, as a reminder, post those to the website where you registered for today's program. Clark, our first series of questions directed towards Brent and Kevin, but really open it up to the full panel. What significant policy changes did you see were necessary? Everything from offender family visitation using technology or in-person visits that had to change, to what you did with your personnel, requirements for them to safeguard their own health in off hours, to bring the healthiest environs back into the incarceration setting. Any significant policy changes and any recommendations for our viewers?
Start with Kevin and then Brent.
Yeah, great question. And the policy changes, the operational changes were significant across the board. And I'll just touch upon a couple. Everything from, we'd start to get staff that would test positive for COVID. And so, of course, we'd have to quarantine them at home. Well, when that would take place, of course, these are 24/7 places that you have to operate. And so, in a lot of cases, we had to change from maybe an 8-hour shift operation to a 12-hour shift operation. And so we had to account for a lot of different things for staffing purposes. I could literally spend another 2 hours talking about that, but other operational changes that might be of interest were technical violations. In a lot of systems, whether that person be on probation or parole, a technical violation can lead you to getting handcuffs put on you. And that practice had to change. Like, we couldn't just keep piling people into our county jails because our county sheriffs were saying, we're inundated, but also our prison systems were inundated. And so in a lot of cases, we had to do a variety of things to slow that flow down. And so in many cases, our system started to look at what is an arrestable offense. And if you try to significantly reduce down technical violations being an arrestable offense, then in fact what would happen is there would be a lot fewer arrests. And so it's a great question. Literally could spend the afternoon talking about all of the policy changes, operational changes that were made. But I'll be quiet, and I'm sure Brent's got some pretty good things that they did in Michigan too.
Great, thank you, Kevin. Brent?
Yeah, and Kevin's right. We could spend a long time talking about the policy changes that we've done, but I guess I'll just start by saying sometimes you start from scratch when the current plans and policies you have aren't working for you. And one thing that was really different for us is there were times when we would talk about doing something we'd never done before because the policy said we couldn't, but we had to be creative. And so the one thing that I will encourage every agency to do is don't get stuck in, I can't do this because we've never done it. You need to take a look at being creative because we had to come up with some creative ways to do some things. And one of those creative ways to do some things is just as simple as staffing. And I know Kevin hit on it, but we literally had some of our non-uniform staff helping us in uniform positions. We had uniform staff that had previous food service experience working in our food services. We had, literally when you get to the point where you don't have enough people to run a prison, you got to find ways to make that work. And we were getting folks we had parole agents that were coming in from the field to help us staff correctional positions. So staffing is a big one. And I would say cross-training. And one thing that we learned is we need to start cross-training our staff a little bit better so we don't get stuck in one job. And when something like this happened, we were struggling a little bit to find people that had some experience in other areas. So cross-training became really important for us, and we're continuing to do that now. Video visitation. I think somebody had mentioned video visitation. And so obviously you don't want visitors coming in while you have some higher COVID rates. So we have looked into 7 pilot sites at our facilities now are piloting video visitation. We hope to expand that. And then we also modified some of the prisoner movement plans to allow for some movement and get them out in groups that we had cohorted, which was interesting to do. And then also working with our vendors to try to get them to a point where we could allow them to make some phone calls, additional phone calls per month and some additional letters per month because they just didn't have visits.
Great, thank you. Dawn, another question?
Clark, a lot of questions from our viewers today for really anyone on the panel about new or renewed partnerships. A lot of conversation today in the theme of collaboration and it taking a village. What partners ranging from contractors to vendors to other government agencies to community groups have you seen emerge during the COVID response and you might see opportunities to continue to partner moving forward?
So let me modify that question a little bit because this is what I wanted to ask Donnell before we went to the live Q&A. Among those partners that we want to contemplate is emergency management. It often is thought that emergency management and the jail prison administrations are strange bedfellows, but in fact, as we mentioned earlier, during the crisis, they're going to depend on one another. So you want to take the first stab at that? You've got, in your role in emergency management, you have access to an awful lot of contract employees and others, at least potentially. So what's your take on the New World Order?
Yeah, in 60 seconds or less, in a crisis or disaster like we're seeing right now, just about every state's EOC, Emergency Operations Center, stood up, and it's usually through their state level emergency management agency, and that trickles down to the county and the local level. The important part about that, and one of the questions why I'd asked Kevin and Brent, is that's where resource requests, allocation, and distribution really happens. In a crisis, you have competing interests. Everyone's trying to get some type of widget or some type of device or series of resources that are of limited supply. And that's why we kind of come together in an emergency operations type of construct to decide and prioritize who gets what and when they get it. And so clearly working with your local state emergency management in advance of something like this is important so they understand your needs. To be quite honest with you, I'll use the same analogies I used last week. There's an analogous between the prison population and the homeless population is that these are often forgotten people. Our panelists talk about that. We don't see them again. They come back 20 years from now. Where have you been, right? So, however, I think that in closing, some of the coalitions that you can bring around this topic aren't just prison advocacy groups. They just can't do it alone, right? I think the public health people on this in this seminar and out there need to see, once again, correctional health as a public health issue. These diseases are moving into the correction system, quite possibly from staff. Bureau of Prisons, Federal Bureau of Prisons, 10% of their staff members were infected with COVID. We don't know if they're the vectors or they're bringing it back to the community. It doesn't matter. We need to get the community and the public health, larger public health infrastructure involved.
One other quick question, then I'll turn it back over to you and the panelists for wrap up. Several questions here about public health reporting requirements. So Brent, perhaps for you in Michigan, or Kevin, if you have a look-see across the nation, are prisons and jails required to report their number of COVID positive cases, both for offenders and for staff? And can you talk just very quickly about what those requirements might be pre-release?
Yeah, Brent, I think you may be the last live Q&A for this session. Unfortunately, we love to get the questions and try and field them. But what are your thoughts about public health reporting?
Well, the short answer is yes, there are health requirements to report at the local level as well as the state level. And we do that for both offenders and staff. And that really, when Danelle talked about bringing together your emergency management, public health is part of that emergency management response now, at least in our state at Emergency Operations Center, and also at the local levels. So yes, there are requirements to report locally as well as at the state level. And all those are tracked by county in the state of Michigan.
Great. Well, I think we have to move to a fairly terse and concise summary right now. I'm going to pose this question to each of our panelists in closing. I hope we can make this a bit of a lightning round. So bullet points, hopefully within a minute for each of you. I'll start with Kevin, go to Brent, and then Donnell will close it out. If you knew a year ago what you know today, what would you have worked on to change, implement, correct, or jettison? If you had that crystal ball, what would you have been focusing very hard on? Kevin?
Would have probably magnified our focus on having experts side by side, like that, like, you know, someone that's there on site right at the beginning of this COVID crisis that could help us manage those critical first few weeks. In addition to knowing across the board who is responsible for what, like who has the authority to do what, you know, as it relates to, de-incarceration or what have you. It would have been nice to have had those types of things in place prior to this COVID crisis.
Thank you. Brett?
I would definitely had a bigger stockpile of PPE in place and also a way to distribute that throughout the agency. That would have been something, supply chain would be something that we would do in the future. Identify staff for incident management teams or strike teams that we could put together. So if it's simple as we need a warehouse, go open up the warehouse plan, and you had staff trained to do that. So having those teams in place. I would also say we've learned throughout the process of this that we need to upgrade our technology a little bit to be able to work remotely. And I don't know if we're the only agency experienced that, but when we were told we were vacating our offices, there were some technology struggles, both by our staff that worked in office settings as well as our field agents with the technology to do some of the things they need to do. Those three things would be my big three.
Off your list. And Donnell, you have the last word.
Yeah, so thanks, Clark. As of yesterday, the Marshall Project had posted on their website 152,000 prison-related COVID cases with over 1,200 fatalities. Going back to the last question we had that Brent answered, I can't tell you what the exact number is, but I can pretty much tell you from my public health expertise that's underreporting. And so we should all have a healthy skepticism of the numbers. It's not because prison officials are underreporting, it's because early in the disaster, we didn't have the proper tools to put to bear to actually do the epidemiology. So ostensibly, there are people who were sick that we don't know that recovered, and there are people who died of other issues that we see with the pathology of this disease, such as heart attack or stroke or lung embolism. And so like any other disaster, and we're already starting to see the numbers, anywhere from 200 to 300,000 excess mortality year over year, you're going to find when the really smart people get together and do a retrospective that we're going to have a lot more fatalities from COVID, particularly in this population that has a high density of people who are disproportionately at poor health than what's reported.
Well, I'm going to close this out with so many thanks to all of the participants and to my distinguished panel. I always learn a lot when we conduct these webinars, and I'm going to leave with a little bit of a reflection. You know, I think we're going to definitely look back on 2020 as a year of compounding crises. But for us at the Center for Homeland Defense and Security, and for our administrator and funder, the Federal Emergency Management Agency, we believe that we want to finish that sentence by saying that 2020 is a year of crisis leadership. You have seen exemplars of that leadership on the panel today. We know in our participant and registrants that there are many, many leaders who are fighting the good fight against many odds. We thank you for your dedication. We thank you for your compassion. And let's keep getting those after action reports written up and shared again before the action is over. Finally, on a personal note, as a moderator, it is rare and gratifying to me to get to work with literally hundreds of SMEs, not just the three formidable, estimable ones we've gathered for you, but all the folks that are on this webinar right now. So thank you again for all of your great efforts. We appreciate you every single day. On behalf of the Naval Postgraduate School Center for Homeland Defense and Security, and our co-hosts, the Association of State and Territorial Health Officials, the International Association of Emergency Managers, the National Criminal Justice Association, and Kevin's group, the Correctional Leaders Association, and the CHDS Alumni Association. Thank you again for joining us, and everybody go out, if you haven't done so already, get a flu shot. Good day, everybody.